These are the expectations we have of the health service providers within the LHIN. We expect that you will be aware of our Integrated Health Service Plan, that you will provide leadership in pursuing voluntary integration initiatives, that you will identify opportunities to integrate services, you will work collaboratively with other health service providers to identify integration opportunities, you will engage the community in these plans, give notice of voluntary integration to the LHIN, comply with the LHIN's integration decision, and be accountable to the LHIN and community for the outcomes of the integration activity. There are a number of fundamental principles the LHIN will consider in structuring its integration decision-making protocols. The planning for and integrating the local health system will be carried out in alignment with the provincial strategic direction and our LHIN's IHSP. We will look at public accountability and transparency, the amount of cooperation and shared responsibility among the communities, providers, the LHIN and the government. The consistency in the decision-making will be promoted, and decision-making will be evidence-based. These are questions that need to be asked when we are looking at is an integration decision in the public interest. You can scroll down through those. We want to ensure that integration is best for our communities, and we need to ensure that these questions have been answered appropriately. As we move through the integration process, the roles of your board and the role of the LHIN board continue to evolve. And you can see that the LHIN board needs to provide strategic leadership to the health system integration. We're expected to lead community engagement. We establish a LHIN decision process and criteria for integration initiatives in the context of the IHSP. We approve and allocate resources to integration initiatives. We sign accountability agreements with our health service provider board, and we monitor the performance and outcomes of the IHSP and integration initiatives. You, as provider boards, provide strategic support of the organization for LHIN system integration. You participate in community engagement and initiate community engagement as required for new initiatives. You establish your policy direction for integration initiatives with others to align with the LHIN's IHSP, which is all of ours. You approve integration initiatives at the level of your organization. You sign accountability agreements with the LHIN and monitor performance. And you monitor performance and outcomes of integration activities within your organization. These are some resources that I encourage you to access. They are all available. These are the ones that we have used in developing our IHSP. We access these, and we encourage you to do likewise. You can access information through our website, and you can see this diagram directs you to that. Again, the Governance Resource and Toolkit is emphasized. It was launched a year ago and was a joint initiative of several provider organizations and LHINs from across the province. We, as the Southwest LHIN, do not constantly create the wheel ourselves. We access resources and information that is out there that other people have developed as well. Now, that was a very fast overview of the blueprint and the IHSP, but we wanted to allow time for questions and discussions. And certainly moving forward, we have emphasized what the role of local health service provider boards is in terms of seeking opportunities for integration and moving forward with those. We'd like to hear from you what integration activities your organizations have undertaken, and they don't have to be huge. They might be small steps, We know that integration doesn't happen overnight. It takes time, a great deal of effort, and a great deal of communication. But we'd like to hear what steps are being taken, and I know that others around the table appreciate the opportunity to learn from your experiences as well. So I'm throwing it open at this time for people to share some of the experiences you've had.